Namaskar to my dear viewers. I'm back with Boggling Conversations Season 2. And today I'm reminded of the mellifluous song from Anand. कहीं दूर जब दिन ढल जाए सांझ की दुल्हन बदन चुराए चुपके से आए. Well, it is said that we look before and after and pine for what is not. Our sincerest laughter is with some pain fraught, and our sweetest songs are those that tell of saddest thoughts. We have faced a lot of trials and tribulations during the pandemic. A lot of people have succumbed to cancer. A lot of people have succumbed to infection. But as a famous saying goes, tough times do not last long, but tough people do. And today, we have an accomplished cancer surgeon with us. Please put your hands together for Dr. Shishir Shetty from Navi Mumbai. He's an accomplished cancer surgeon and he is a head of the department and professor at Apollo Cancer Society. He's been operating upon a lot of, he's a surgical oncologist. He's been operating upon a lot of cancer patients and he is heavily experienced. Welcome to Boggling Conversations, Dr. Shetty. It's a pleasure having you on our show today. So how is the pandemic treating you, Doc?
Thank you, Purnima. Pandemic, nobody is really liking the pandemic.
Absolutely.
So pandemic
Yes.
has treated everybody and has put everybody to their worst and the best.
Yes.
So it's crazy. I think the first pandemic, the fear which was we had, second we are more comfortable. First pandemic, we were shit scared. Nobody knew what the hell was happening. Everybody was crying.
Yes.
Protocols
Yes.
were being laid. So, yeah, but this time we were more comfortable. There was no scare.
Right. We were mentally prepared. We were armored for the battle, so to say. But last year, Doc, COVID was not very close. But this year, in the second wave, COVID was pretty close. And our near and dear ones, relatives, friends, most of them succumbed to infection. So will the third wave be all the more catastrophic? What do you have to say as a surgical oncologist? What is your take on the pandemic, doctor?
So it's been a tough time, whether it was the
Yes.
first wave, second wave. And
Yes.
this is going to be
Indeed.
periodic. This
Yes.
is going to be periodic. It's like first wave, second, third, fourth. And I think eventually we will start looking at it as if it's like any other flu. Like
It's
the
like a
common
part
cold
and
we
parcel of
have,
our
we
life.
will probably take a jab every year. But that's a way to look at it, and that's a positive way to look at it. Yes, we have lost a lot of people, especially in the
Yes.
second wave. And things were bad. Things were bad. And the type of complications, they were really
Yes.
sad. Yes.
Absolutely. So, doctor, during the pandemic, I guess, the immunity of a cancer patient is already pretty low. So, in what way has the infection affected the cancer patients?
So let's put it like this: whether you have cancer or no, everybody is prone to COVID if you are exposed to a particular surrounding. Now,
Correct.
if you get COVID and if you happen to have cancer, then that is if you are going through a treatment of cancer, then things can be tough on you. Okay,
Correct.
I have had a lot of cancer patients who got COVID, but they came out very well.
Oh,
So
really? Oh,
yeah,
okay.
they came out well. So none of my patients have died because they got COVID. So I was
Marvelous.
very lucky and thankful to the doctors who are treating them, and we were in touch. Half of the time we were in touch, thinking how things would go, and
Correct.
I was very lucky. But yes, there is the scare, especially those patients who were going to come for surgery and they become COVID positive.
Oh, okay. All right.
So the
All right.
surgery gets postponed for
Mm-hmm.
2 weeks, 3 weeks till they become COVID negative, their lungs become okay. So that was the biggest problem that I faced during the first pandemic and the second pandemic. First pandemic, Nobody really came out of their houses for surgery. So that was a very big scare. Yes.
Correct, correct. So the surgeries, got postponed because of the infection or the scare of infection. Let me put it this way.
So let me put it this way, that patients were not coming out of their house.
Okay.
One, isolation. They were
Yes.
taking care by home remedies, whatever the complaints they had. Uh, this eventually led to some other problems like delay in diagnosis, because they
Okay.
would not go to their general practitioners or their gynacs for checkups. So
Correct.
there was a delay. So this delay of diagnosis has caused an upstaging of the disease.
Upstaging of the
So
disease.
the
Correct.
tumors that we were supposed to see at T1 and T2, that is stage 1 and stage 2, we started seeing them at stage 3 and stage 4.
Oh my God. So it
So the
escalated.
worry that we had and we still have is that a lot of people are going to die because of delayed diagnosis of cancer, not because of
Correct.
COVID. But this is the indirect effect of COVID that we are seeing, and that is
I
really,
see.
yeah,
That is really catastrophic.
yes.
Doctor, has cancer anything to do with lifestyle, smoking, addiction, obesity? How do you relate lifestyle and malignancy? How do you connect these two?
So it's not rocket science. Cancer is a lifestyle disease.
Okay.
So it is very clear. It's associated with lifestyle. It is related to your habits, and definitely because of smoking. Definitely to your diet. Definitely lack of exercise. Definitely.
Yeah.
So if you get those things right, I think you can keep half of the cancers away.
All right. Okay. So is cancer reversible if a person starts exercising and if a person follows a strict dietary regime?
So cancer does not happen overnight.
Yes.
Okay. So there is a
Yes.
whole process. There's a whole process. It's like if somebody is going to get a cardiac heart attack, then
Right.
there is a whole process that we have abused our body
Yes.
over a period of time.
Indeed.
It has not happened overnight, right? So the
Yes.
best part is when you start abusing your body, stop it. Stop abusing yourself. Take care of your body.
Absolutely.
Take care of your temple that is here.
Yes.
We go to temple, we go to mosque, we go to church, we keep that place so clean and pious. At the same time, we forget to keep the inside clean.
Hmm.
That's where it really matters, right?
Absolutely, doctor.
Yeah. So
And
you
I
keep
think
your
that,
inside clean, you keep
yes,
yourself clean, you keep, you eat well, you exercise well, be fit. I think that's what matters finally.
absolutely. Doctor, our observation is that, statistics say that American Medical Association has already accepted obesity as a disease. They've declared it as a disease. Why are we in a denial mode in India? Why don't we accept obesity as a disease? After facing so many problems, we rank the number one in diabetes. We've had so many cardiac failures during the pandemic. Why aren't we still accepting obesity as a disease?
Isn't it funny that we call ourselves a third world country
Yes.
and we have the maximum number of bariatric surgeries happening in the world?
Yes, yes.
All right. So I am confused whether we are underfed or overfed.
Uh-huh.
All right. So we got to get our facts clear. So it's not about underfeeding or overfeeding. It is about not getting the right nutritional feed.
Right.
The
Absolutely.
problem is there. The
True.
problem is there. The what America or the Americans faced 20 years back, we are facing now,
Yes, yes. Very
right?
true.
So,
Very
so
true.
20 years back when I started my practice, I hardly used to see prostate cancers. I hardly used to see
Mhm.
colon cancer. Very less
Correct.
number. The
Hmm.
numbers now have increased.
Yes,
These are what? These are lifestyle diseases.
yes.
Okay.
True.
Gutka was our invention. India's greatest invention is gutka, greatest invention to cancer care, because the number of cancer patients increased after gutka came.
Mm-hmm.
So we did our best, believe me.
Yes. Yes.
So
Yes.
we should not be blindsided. I think we are just in a big denial
Yes.
about this. I used to tell before the COVID started that at the rate at which the cancer is increasing, there will not be enough beds in our
Mm-hmm.
country to treat patients.
Yes.
COVID has proved them right. When COVID came, we didn't have beds, we did not have facilities. Government started investing in infrastructure.
Mm.
You understand?
True.
So
True.
the biggest effect is we need healthcare facilities, but
Yes,
then
we do.
creating more. It's best to avoid and maintain a healthy lifestyle, and we should get the cancer incidence down in our country.
Yes.
So
Yes.
our whole aim would be to decrease, to avoid, to live a better life. Treatment,
Yes.
yes. India is at its best. We are one of the best surgeons. We have the best medical oncologists. We have the greatest good hospitals. Even
Yes.
even the smallest of the hospitals can treat cancers. It's not that you need to be at a big government hospitals. People get treated. So yes, cancer can be treated, but the most important thing is you have to come early diagnosis.
Yes.
In COVID,
True.
all this has gone for a toss.
It has. It has. It has affected the cancer patients the most.
Yes.
Doctor, my question to you is, is cancer genetic? Does family history play a pivotal role when it comes to diagnosis?
So if you take all cancers, if you take all cancers, a small portion, less than 10% of the cancers are genetic.
Yes.
I would put it
Okay.
at 5 to 7% are genetic, not all.
Okay.
So in certain cancers, genetic cancer became famous because of a very famous Bollywood actress for which she got her breast removed, thinking that she became BRCA positive. And then
Mm-hmm.
she got her ovary out because they thought they had a BRCA gene. So
Mm-hmm.
after that, the genetic origin of cancer became a very big thing,
Mm-hmm.
or rather, it became popular. So anything which is associated with
With
Bollywood, with
Bollywood,
Hollywood, it automatically glamour
gets
industry,
viral.
everything. Yeah,
Yes.
right. So yes, in a way, it has helped because it has increased about cancer awareness. They have celebrities have helped. Celebrities have really helped in fighting this cause, fighting this uh, removing the negativity out of cancer and making people aware, and it's
Okay.
good. And yeah, I really appreciate their support.
All right. But why do these celebrities, Bollywood stars, and sports, why do they go all the way to USA for treatment? Do you mean to say India lacks something? Why do you have to go all the way to US for cancer treatment? And does that
So,
mean you survive or reverse cancer by, taking atrociously priced treatments, exorbitantly
so
priced
I asked
treatment?
this question once to when I was training in America. So I asked one of the famous personalities who I met there, why did you come here for treatment? We have so many good hospitals there. So he said, doctor, please understand, for us, privacy is so important.
Oh,
We know that we've got great doctors and we know that they will take care of us. And the treatment is the same everywhere. But the most important thing is nobody will recognize us. So privacy is important. And
okay.
there is a general trend that we see is that you want to fly to Singapore, you want to go there, but I think as I sit today, as I sit at Apollo Hospital, let's look at Apollo Hospital. We got a proton center, which is one of its kind in South Asia. You
Correct.
see the whole of practically the whole of Asia, half of Europe doesn't have a proton. So we are delivering that type of care. The type of robotic surgeries we do, I think we are far ahead. Technically,
Yes,
as Indians, Indian doctors are very much in demand in India, in Europe, in
yes,
America. I think Indians have done very well.
right.
So I don't see any reason maybe why they should go, but I assume it must be for privacy.
All right. So it's just for privacy. Otherwise,
And
technologically, I don't think India is lagging behind.
somewhere if you have that white skin complex,
Yes, yes. I understood what you said.
yeah,
Yes.
people just assume that if anybody is an American, he must be good. Yeah.
Yes, yes. I think we also need to get out of that mindset that whatever is, American or whatever is European is good. And we sometimes underestimate the power of our own country.
Yes.
But as you said, so many Indian
And
doctors are working.
anything which was Chinese was duplicate or long lasting, and look what they caused.
Yes, so these are the stereotypes, and I think it may sound, cliched and hackneyed, but to tell you the truth, yes, India has to. If India has to progress, we need to broaden our minds. We need to broaden our perspective. You are absolutely right, Doctor. So we talk about benign tumors and we talk about malignant tumors. And I'm sure a lot of viewers have joined the show and they would like to know the difference between benign and malignant. And when exactly does cancer become a cause for concern?
So any tumor which is not spread, which has not spread, is benign tumor. Okay, just
Okay,
out of the
okay. Which
total.
hasn't
Name and
metastasized.
sum, which
Yeah,
is localized, which doesn't have the potential to spread to another organ. Okay, so this is a
yes,
local. So there are fat tissues like lipoma, neuroma. These are all benign. Like breast lump, fibroadenoma. These are benign.
correct.
Any tumor which has got the potential to spread, say from the breast to the lung, to the brain, to the bone, they are malignancy.
Okay,
All right, so this is the basic. The potential to cause harm is very, very high in malignancy. So this is the basic difference of benign. Benign, you don't have to worry much. Malignancy, yes, you have to
Okay.
worry.
All right, all right. So malignant tumors are a cause, and then probably the stage is also a cause for concern because if the cancer is detected at an early stage, stage one and stage two, maybe it's
Right.
curable, but once it reaches stage three and stage four, I think a surgical oncologist and radiation oncologist here, play a pivotal role. Then the chemotherapy and radiation.
So let's put it like this.
Yes,
There are solid tumors and there are
yes,
hematological cancers. So solid tumors are like breast cancer, stomach cancer, lung cancer,
right.
pancreas, rectum, brain. These are all solid tumor cancers. And
Correct,
then
correct.
you have hematological, that is all blood related, like you have
Yes,
lymphoma, leukemia, and its various different types.
yes,
The treatment is essentially different. There is no
yes,
surgery done in the blood lined leukemias. They are all
true.
chemotherapy and that line of treatment. In solid tumors, most of them end up, if you come in an early stage, most of them need surgery. So, like
Right.
breast cancer, if you are in stage one, you will need surgery. If it is
Yes,
a little advanced, sometimes we give chemotherapy first, then give surgery, and then radiation.
correct,
If it is very advanced, no surgery, only chemo and maybe radiation. So it depends
correct,
upon the role, the type of tumor, where it is located, the size of the tumor, and whether it is spread or not, to decide what is the best modality of the treatment. That is why we have something known as tumor boards, where a surgeon, a medical oncologist, a radiation oncologist sit together and then we
correct,
decide on the best modality of treatment.
correct. Absolutely, doctor. So, doctor, there are minimally invasive procedures now. We have robotic surgery now. You think, as a surgeon, you are thoroughly blessed, with minimally invasive, with, laparoscopy and with robotic. You think your job has become easy or complicated?
So let me look at it that over the last 100 years, most of the surgeries which were done in the last 100 years, very few surgeries have changed. Okay,
Right.
uh, the technicalities of things have changed. Like we have now very good anesthesia. We've got blood
Yes.
products. The risk taking potential of the surgeon has changed. The
Right.
patients
Right.
are better. The understanding of the human body and the anatomy has changed. The
Correct.
tools that we are now equipped with like a laparoscope, which started off, and now we have the robot. Uh, now let us look at as a surgeon. Now I'm getting old as a surgeon, right? So if my hands start shaking, then I may be
Wobbly.
useless as a surgeon. But if I have a
Hmm.
robot, then it is not that the robot is going to do the surgery. I am going to operate the robot, right?
Yes.
So
Yes.
it will it will handle my tremor.
Yes.
You understand? So my visual acuity is increased. Now I have got a three-dimensional view through a
Yes.
small incision in the abdomen, through a small keyhole. I can visualize the abdomen and I have a 3D vision right in front of me, and I don't have to stand like I used to stand before. I can nicely, comfortably sit on the console and I can do the
Yes.
surgery. So, yeah,
Very
things have become
convenient.
better. So, things
Yes.
have actually become better. We got better instruments, we got better coagulation or better instruments to take care of bleeding, hemostasis. We have better anesthetists and better understanding of anesthesia. So
Correct.
the patients are more comfortable. The pain care has improved dramatically. Now it is a separate specialty by itself. So you understand the what was say a Whipple's resection done 100 years
Yes.
ago. The
Okay.
basic surgery has not changed,
Yes. Whipple's
but
procedure has not changed. Yes.
the result of the surgery has changed dramatically over the last 100 years. You understand?
Well,
The
that's
technique has changed.
progress.
The technique has changed. The suture materials have changed. We have better blood and blood products. We understand hemostasis. We got better cautery, electrocauteries. We are dealing with so many beautiful instruments devised by mankind to make a
Yes.
surgeon's life easy. We got excellent anesthetists. We got intensive care, which can get them out of this thing. So that is how. That's what progress is all about. So people
Yes.
are living longer.
Absolutely.
Yeah. And the risk taking
Doctor,
capacity
yes,
has
the risk taking
probably
has
increased
reduced.
because now we have started operating on more elderly. The people
Yes.
who would normally we did not, then we started taking those risks. Although we know that yes, there is a problem that patient can go through, but we have started trying to get them out of this.
Correct.
Yes. And we
Absolutely.
as a human race, thanks to medical science, are living longer. and
Right.
and believe me, it's not a great boon because the curse of living longer is probably getting more cancers, getting more diseases, and
Hmm.
and then the challenge or the onus of treating that lies with doctors to
Hmm.
treat that. So the
Yes.
expectation from doctors as a community has increased.
Right.
There was a time,
Absolutely.
if there was a time, I know, because if somebody had gone for a heart surgery, they would have a prayer. We don't know whether he would come alive or not.
Hmm.
Today, we don't talk like that. Very few heart surgeries fail, right?
Yes. Yes. The
Very
success
few.
rate has increased.
Success
Yes.
rates have increased dramatically. So people expect that anything to do with that, you enter a hospital, you should be good.
Oh,
So the
yes.
expectations have increased.
Yes. No doubt about that.
So the
Doctor,
responsibility and the expectations, yes, definitely has increased.
increased. So there was a patient who was complaining of an excruciating pain in the back. Tried several orthopedic surgeons, orthopedicians, tried several treatments, physiotherapy, and ended up with thoracic schwannoma, spinal tumor, i.e., spinal tumor. So, how rare are these spinal tumors, doctor? How
So
rare is
schwannomas are
thoracic
pretty
schwannoma?
common. Schwannomas are pretty common. It's not that rare. I have done
Okay.
quite a few of these schwannomas. I've done schwannomas of the chest, schwannomas of the skull base. I in
Oh
fact
my
did
God.
one last week. Yeah,
Hmm.
I did one schwannoma of a young lady, 27 or 28-year-old lady,
27
skull
years
base.
old.
Yeah,
Oh,
skull base.
all right.
Yeah, so we've done. Schwannomas are benign tumors; they're not cancerous.
But wrong diagnosis can can it be lethal? Wrong
So what
diagnosis.
so what happens is schwannomas, if it is if schwannomas are not cancerous, but if it
Okay,
is growing in a small confined area, if it is growing like this, then it will grow bigger. Nothing would happen, right?
all right.
If it is
Yes,
growing inside the spinal cord, then it would press onto the nerve and create a problem.
I see. Okay, okay,
You
okay,
have
okay.
understood, yeah.
Yes,
So,
yes, absolutely, doctor.
so it is definitely treatable and curable.
It is treatable as well as curable. Dear viewers, so we have a positive sign. Schwannomas are benign tumors, says, Dr. Shishir Shetty. We had one 12-year-old who ended up looking much, much older because of adrenocortical tumor. And she, ended up visiting an endocrinologist who asked her to, go in for a surgery. But after surgery, she was absolutely fine. So are adrenocortical tumors normal? Are they
So
common?
we are talking about pituitary tumors.
Yes, yes.
These are brain
Pituitary
tumors.
tumor,
Yeah, so these are brain tumors which are done by the neurosurgeons. And nowadays,
neurosurgeons.
these tumors, these tumors are located at right at the skull base. So you can put in an endoscope, and we got some great surgeons who are doing endoscopic surgery, and
Yes,
very good
endoscopic.
results. Very good results. I'm so impressed. And
Can
they're
it be
not.
done laparoscopically also, doctor?
It is, yes. It is
It
endoscopically
is
done.
endoscopic, yeah. Okay. Minimally invasive.
Yes.
Yes, absolutely. And when we talk about pleomorphic adenoma, again, is it malignant or benign?
Pleomorphic adenoma of the parotid gland is
Yes, parotid gland
a benign thing.
is a benign tumor. I see. Okay. It is said that a lot of, there is a virus present in the body, human papilloma virus. And these days, I guess HPV vaccines are available, hepatitis B vaccines are available. But do you think an unhealthy sex life can lead to, HPV, and can it increase the chance of throat and cervical cancer? Is my question, doctor.
So let me put it this way: that
Okay.
if that HPV, human papilloma virus, is a sexually transmitted infection.
Okay.
Okay, and in India, cervix cancer is the most common cancer, which used
Okay.
to kill number one killer in women in India.
Number one
Fortunately,
killer in women in India.
women
Okay.
in India,
All right.
apart from breast cancer, these two things used to compete with each other. The good news was that cervix cancer has gone down in the
All right.
last, by a significant. That is the only cancer which has gone down. Rest all cancers have increased.
All
So,
right.
so one of the best things is probably because of hygienic methods, barrier contraceptives like use of condoms. This has prevented the spread of sexually transmitted infection. Having a better lifestyle has changed the course of the disease. Having a vaccine has definitely helped, and it is
Okay.
going to help prevent cancers in our children.
Correct. Correct.
Yes. Hepatitis B can cause liver cancers.
Liver cancer. Yes.
Yeah. So if we can get ourselves vaccinated, we should.
And what is the age? Our viewers would like to know the criteria, the age. Do
So
they
the best
qualify? Does
age,
everyone qualify?
so the best age for HPV vaccination is between the age of 9 to 16 or before the first sexual contact. Okay,
Okay,
before
before.
they get married,
Mhm.
that would be the best time to take it. If not, you can take it up to 30, 35. They have now extended it, but I personally feel up to 30 is good.
Okay, that's and what about hepatitis B vaccine?
Anybody and everyone should take it.
Okay, and how about the COVID-19 vaccine? Is it safe for cancer patients, doctor?
It is. All our
Okay.
cancer patients, we are giving certificates to please go and take their vaccinations. Yes,
Well,
all are
that's
there.
mandatory. That's mandatory. As
Yes.
Dr. Shetty says, it is absolutely safe for cancer patients. So
And
do get yourself
all of them,
vaccinated.
all of them, we are telling them.
Okay, so that's positive. That's positive, doctor. So I had a word with a gynecologist who observed that in some cases, HPV, the girls tested HPV positive, but their pap tests were absolutely normal. So how does this happen? I mean, the pap test is normal, yet the patient is HPV positive.
So, for a patient to first get HPV infection to becoming frank cancer, it may take some time.
Okay,
Not
okay,
all HPV infection, if a lady gets, becomes cancerous. These are the patients
okay,
who are kept on follow up to see for changes. The
all right.
HPV DNA which is done is a vaginal swab test which detects HPV DNA. There may be
Yes,
no cancer seen. These are the patients who you should keep under observation. Many
all
of
right.
these patients, the HPV disappears on its own
All right. But
without causing a problem.
without causing a problem, which is positive. But, do you think this happens with healthy sex life? Do you think healthy sex life is responsible for prevent cancer prevention in such cases?
Yes, I suppose so. Of course.
All right. And is it a myth that vitamin C can, actually reverse and prevent
More than
cancer?
healthy sex life, of course, that is important. Hygiene,
Yes.
hygiene. I think
Hygiene is.
in our country, the biggest thing that has happened is the teaching of hygiene by the Anganwadi workers. So the at the grassroots level, the government has done very well in educating ladies from our rural India. You see, cervix
Correct.
was a rural India problem. Okay, the
Yes,
majority of
yes,
the cervix cancer were from the rural India. Urban India, the breast cancer was on the top.
yes.
Okay, so now that whole, I think the hygiene is something which is making a lot of difference. Yes.
That is making a lot of. So, do you think, we are now, a lot of NGOs and lot of cancer prevention societies are creating awareness amongst, people? I think,
Everybody,
Padman, the movie Padman also changed. I think, you talked about Bollywood. So, when Akshay Kumar talked about it, I guess the rural people were more, convinced. So,
I told you, I love celebrities because of their sheer power, sheer
correct.
power, their fan following, and whatever they say
Yes,
is the gospel truth. So it
gospel
is,
truth.
and in fact, it is so much of a responsibility on them because we actually, we try to rope in many of the popular celebrities to speak about cancer, to spread awareness because
Yes, to spread awareness
somewhere they
about
say
AIDS,
that
cancer.
if
Yeah.
Shah Rukh Khan says or if Salman says or if Amitabh Bachchan says, that matters. Dr. Shishir Shetty says nobody is gonna listen.
But ultimately, these film stars are going to come to you, doctor. You are going to operate upon them if they catch a disease. So I think,
So
doctors,
all the more, people, celebrities have a greater responsibilities
yes,
on how they behave in their public life.
yes, yes.
So if you look, the biggest influence of smoking and
Hmm.
alcohol actually came from celebrities at one time
Yes,
or advertisements. or advertisements. If you
Gutka and whatnot. Gutka.
if you look at one of the oldest Marlboro ads, which came up, and it was smoking was promoted as a fashion statement at one time, and that's how
Hmm.
the whole world caught up with it, right? So things have changed. Things have changed. Now celebrities are so very conscious, and they are so fit, and they want to promote. I'm so impressed when I see some of them. They are all amazing.
See, even a packet of cigarettes says that cigarette smoking is injurious to health. And before watching a movie, they show us all kinds of ads, how, tobacco is lethal and everything. But, we don't think of banning these things. We show the ad, but the ad is not taken seriously at all. So why don't we, as, doctors, do something about it?
Uh, I wish I can do so many things in life. There are some things which the government has to decide,
Correct.
because it is not easy,
Hmm.
because there is but people, finally it is up to the people. If it is me, that it's me, I'm talking about me. If I decide to change today, then I should stop smoking. If I decide to change, I should start exercising, because I am not doing it for anybody else. I'm doing it for me, myself.
That's for your well-being. Yes.
Yes. So, uh, if I want to live longer, why should I blame the world?
Yes. Yes. Makes
So,
sense.
revolution, I feel, revolution starts from me. If I change, I can influence other people to change. I can influence Purnima to change. Purnima can influence 100 other people to change.
Yes, yes.
Why should I always
True.
differ? So I admire some of them who take it as a cause and do that. I see so many, youngsters talk about please wear your mask
Mhm.
in COVID
True.
times, because they have taken it as a bonus to make people aware. Please wear a mask. I have, in fact, I have seen people tell me, please wear a mask. Yes, yes, okay, I will, please. So that's how it has been. I
Yes.
think the onus starts with us. The responsibility lies with us. We can't keep
Very
blaming
well said.
others.
Very well said.
Finally, I am going to smoke. Government is not making me smoke.
Yes. It is an
Right?
individual responsibility.
If I am not
Yes.
exercising, I am responsible for it. So still
Yes.
I start taking the onus, nothing is going to happen.
Yes. Correct. So the responsibility, yes, to respond with ability. Responsibility is all about responding with ability, and the onus is on us. Very well said, doctor. We were talking about breast cancers.
I can't hear
So,
you.
uh, I beg your pardon, doctor. Okay, am I audible?
I'm sorry, I'm unable to hear you.
Oh, what's wrong? All right, are you able to hear me now, doctor? Am I audible? Doctor, am I audible? So we were talking to Dr. Shishir Shetty about, certain cancers. And, I realized that, he has asked us to be very, very careful, responsible. And he says the onus is on us. We have to respond with ability. It is our duty as, citizens of India to prevent cancer by adopting immediate corrective measures, by adopting a healthy lifestyle. The onus is on us, says Dr. Shetty. Dr. Shetty, we were talking about, breast cancers. So how frequently should women get their mammograms done? How frequently should women get their mammograms
Can you
done?
hear me? I'm so sorry.
Yes,
I
yes,
can't hear
perfect,
you
perfect.
anymore.
Uh, So, doctor, I was just talking to the viewers because I think, you just lost your connection. So I just thought I'll keep the viewers busy. Am I audible now? Okay, so we were talking about, breast cancer. How frequently should women get their mammograms done?
So anyway, I think till they get the line in order, if anybody's got a question, they can just WhatsApp, or they can send a message on this site, and we'll be able to hear.
Yes. So. All right, I'm very much around, doctor. I don't know what's wrong with the connection really, but I'm very much there. And I wish to ask a few questions on behalf of our viewers as well. All right. So some medical practitioners, do recommend loads of vitamin C, high doses of vitamin C, which which boosts our immune system. So it is advisable. Vitamin C does help a lot of us, will help a lot of us. I wanted to talk to Dr. Shetty about, certain types of, prostate cancers and cervical cancers. But, unfortunately, he's lost the connection with me. And as a surgical oncologist, he has played a pivotal role in treating all sorts of cancer patients. And yes, the radiation oncologists and surgical oncologists are doing a fab job. I wish to ask Dr. Shetty, his message for our viewers. Dr. Shetty, do you have a message for our viewers?
I can't hear Purnima at all.
Is it fine now? I think, we will ask the viewers to inbox their questions. And, Dr. Shetty will be very happy to answer the questions. And we were talking to Dr. Shishir Shetty, the surgical oncologist and accomplished surgeon from Navi Mumbai, who's the head of the department. And we had a boggling conversation with him regarding the truth of cancer. So I'm grateful to Dr. Shishir Shetty for joining us, tonight. And he's answered all the questions, satisfactorily. He's done a fab job. And I'll be back with yet another episode of Boggling Conversations very soon. So viewers, please stay tuned and please stay connected. Good night. Shabba khair.